Sorry?
In South Africa today, it is estimated that 2.28 million people are living with diabetes. If you have newly diagnosed diabetes, you will have been thrust into a world of seemingly confusing blood tests, treatments, and advice. Dealing with this information can be overwhelming, and one can be tempted to put it aside and continue with life as usual. One can live with relatively high blood glucose and have no feelings of ill health. However, with diabetes, we need to take a long-term view. Left unchecked, high blood sugars will eventually cause complications that can affect our health and profoundly influence our lives. But we can alter this progression if we become managers of our own health, if we learn to know our numbers. Before we get to understand the importance of the various numbers in preventing complications, let us look at the complications themselves. High blood sugar causes damage to the nerves and blood vessels in our bodies. We can divide these complications into those which affect small blood vessels, known as microvascular complications, and those that affect large blood vessels, known as macrovascular complications. Areas of our body where diabetes causes microvascular complications are the eyes, kidneys, and blood vessels that supply the nerves in our hands, feet, and genitals. Macrovascular complication occurs when the large blood vessels in our hearts, lower limbs, and brain are affected. This can lead to stroke, heart attack, and diabetic foot ulcers, or even amputation. In this presentation, we will look at the numbers that you need to get to know in order to prevent macrovascular complications. Our pancreas produces the hormone insulin. Insulin enables glucose to move from our bloodstream into the cells of our body and be used to produce energy. When one has diabetes, insulin is either not produced by the pancreas or the cells in our body do not respond to the insulin. This leads to a high level of circulating glucose in our blood, which causes damage to the linings of our blood vessels. It also promotes the formation of fatty deposits and blood clots. This narrows the width of the blood vessels and decreases blood flow. Scientific studies have shown that lowering our blood sugar to near normal levels can reduce our risk of complications. People with type 2 diabetes who reduce their blood sugars are 19% less likely to suffer from cataracts, 16% less likely to suffer from heart failure, and 43% less likely to suffer amputation or death due to peripheral vascular disease. So, what numbers do we need to be aware of with regards to our blood sugars? The first is our HbA1c. Richard was diagnosed with type 2 diabetes 3 years ago. His doctor explained that his blood test showed an HbA1c of 10.5% and that he would need to reduce this in order to avoid complications. But what does this mean? Your blood contains red and white blood cells. These cells are suspended in plasma as they travel through your blood vessels. The red blood cells contain chemical compounds called hemoglobin. Normally, hemoglobin is used to carry oxygen to the cells in the body, where it is used for energy. Glucose is also needed for energy. In healthy individuals, it is carried in plasma, and then insulin aids its movement into the body's cells. In diabetes, there is either no insulin or the body does not respond to the insulin. The glucose builds up in the body and attaches itself to the hemoglobin in the red blood cells. As your body remakes new red blood cells about every 3 months, we can look at the amount of glucose attached to the red cells. This will give us an idea of your glucose control for the last 3-month period. Based on research, international bodies recommend that you achieve an HbA1c of less than 6.5% in order to avoid complications. This number may vary slightly for certain individuals. younger, or newly diagnosed individuals with fewer complications are recommended a target of 6.5%. People who are elderly or already have existing complications may do better having an HbA1c of 7 to 8%. Your doctor will advise you on the target that is right for you. Conditions that affect your red blood cells, such as anemia and renal failure, will make the HbA1c test less accurate. You will need to interpret it together with home glucose monitoring. Richard is now aiming for an HbA1c of between 6.5 to 7%. He is doing this by eating a balanced diet, low in carbohydrates and saturated fat, and rich in fruit and vegetables. He is reducing his weight, exercising regularly, and taking his medication as prescribed by his doctor. In order to work towards reaching your targeted HbA1c, one has to make sure that your daily blood sugars are under control. Lynn Dewey developed type 1 diabetes 2 years ago. At first, her HbA1c was high as 12%, but now she has reduced it to 6.5%. In order to do this, she tests her blood sugar on waking. We call this her fasting blood sugar. It is recommended that fasting blood sugars are kept between 5 to 7 millimoles per liter. Later in the day, she tests her sugar before meals and 90 minutes after a meal. Before we eat, our sugars should be between 4 and 7 millimoles per liter. 90 minutes after we eat, they should not be more than 9 millimoles per liter. All people with type 1 diabetes and those with type 2 diabetes on insulin need to test their blood sugars regularly at home. People with type 2 diabetes who manage their diabetes with diet, exercise, or oral medication may test their blood sugars at home for the following reasons. They may want to educate themselves as to how certain foods or exercise affect their blood sugars. They may want to monitor if their oral medications are working or monitor the effects of a changed treatment. However, having well-controlled blood sugar is only one of the aspects needed to protect our blood vessels and prevent microvascular complications. High blood pressure also increases the risk of blood vessels and organ damage. Richard has regular blood pressure checks and is working towards keeping his blood sugar in the recommended range, no higher than 140/80 millimeters of mercury. If he showed any sign of eye or kidney disease or had had a previous stroke, he would have to keep his blood sugar in the range of 130/80 millimeters of mercury. The lifestyle changes he is implementing to keep his blood sugar levels on target will also aid him in keeping his blood pressure under control. Lastly, Richard needs to be aware that having raised fats or lipids in his blood also poses a threat to occluding his blood vessels. His doctor has pulled blood in order to do a lipogram. This blood test looks at a range of different lipid values that affect one's health. Guidelines do not set specific targets for lipids, but these figures are offered as a guide to aim for when you are reducing your cholesterol. Total cholesterol should be under 4 millimoles per liter. LDL cholesterol should be below 2 millimoles per liter. HDL cholesterol should be at least 1 millimole per liter in men and 1.2 millimoles per liter in women. Triglyceride levels should be less than 1.7 millimoles per liter. Richard has been advised to have a diet with fewer saturated fats and exercise for 30 minutes 5 times a week. He may be prescribed medication to lower his lipids if he cannot control them by diet and exercise alone. So, let's recap what we have learned. Have your HbA1c done 3 monthly. Aim for a level of less than 6.5% unless directed otherwise by your doctor. In order to achieve this, Keep your blood sugars between 5 to 7 millimoles per liter on waking, 4 to 7 millimoles per liter before meals, and less than 9 millimoles per liter after meals. Make sure your blood pressure is no higher than 140/80 millimeters of mercury. Know your specific lipid profile and set values to strive towards with your doctor. Modify your lifestyle to include a diet with fewer carbohydrates, less salt, and saturated fat. Eat more fruit, vegetables, and fiber. Do 30 minutes of aerobic exercise 5 days a week. Take your medication as prescribed by your doctor, and let your doctor know if you are not seeing your blood sugars drop into the suggested ranges, or if you are suffering from any medication side effects. It is in your power to get to know your numbers and live a healthy and productive life.